nurse ratio, make sure that one nurse is not responsible to 20 patients. The ideal number would be 4 to 1. Improve wages, and I know that has a lot to do with economics, and also improve media coverage. The more you cover this conference and the media, the more you're going to find young students, male and female, who want to attend the nursing program. Develop strong nursing advocacy by establishing nursing councils and national organizations. The United States became so advanced and powerful in terms of nursing profession because we have the American Nurses Association, we have the Academy, and we have all the certified nurse practitioner groups that can advocate for nurses. So I would strongly suggest and recommend that you put a lot of effort in developing and organizing the nursing council and provide the financial support, because they can't do work unless they are compensated. And develop the leadership skills. We do have actually a lot of nursing programs and masters that have leadership skills in developing leadership skills, and it is something that can be learned if you're not naturally born leader, but there are a lot of ways that you can improve your leadership skills. We need to develop competencies in policy and politics. We must have, and Dr. Ellen Becker is here, and she is an expert in policy. We need to develop nurse leaders who understand policy very well, and of course, politics. Don't be fooled. There is a lot of political things that go on when you are actually advocating for your own profession. Regional partnerships can make things cheaper for countries who are low income. So I suggest that Egypt, Jordan, and many of the countries get together to develop benchmarks and partnerships, and establishing interprofessional partnerships too, which is very helpful. We cannot love the doctors or doctors love us only, but we have to have a working relationship with them, because we always sort of walk into each other's profession. Developing interdisciplinary research and developing global partnerships. We do improve the nursing image and quality of care through globalization, because we are not existing in vacuum. As you can see, there are a lot of us that are from different regions and countries. Technology is helping a great deal in terms of making education available to a lot of countries. So we need to use the technology as much as possible. We have to promote individualized nursing practices globally. And we can actually work together globally in terms of increasing standardization of nursing education and practice, so that people who are from Cairo can go to United States. People from United States who come to Cairo, they can practice because they have the same preparation. And it decreasing the cost of nursing education through partnerships. We don't have to have PhDs in every small country. We can have a PhD in countries that are small, that are close to each other. Research is very important, and I know it's very expensive to do research, and many countries do not have the kind of funding that the United States provides for nurses to do research. So it is important that we spend a little money to do research, so that countries that are not part of United States develop their own standards and their own benchmarks, because whatever works in United States may not work in Cairo. So we need to be very cognizant of that. The shortage of nurses in low-income countries results in lack of nursing research. You don't have nurses to cover the floor, you don't have nurses who can do research. And there is limited higher education programs in low-income countries, because PhD programs are the most costly for the United States, so you can imagine how costly it is in other countries of the world. So you can actually partner with other universities, just like we are doing with actually Cairo University and with the hospital here, to make sure that it is much more, it's cheaper and more attainable by the nurses here. We can have mutual exchanges. Dana-Farber is doing quite a bit of work in children's in terms of having a nurses exchange, students and training. We can have some of the to come to United States and see our clinical areas and vice versa, and our students coming here. We can have research partnerships, and that works very well. We can have actually investigators, principal investigators from many countries to do the same research in different parts of the country. Leadership that transcends national borders. As you know, the ICN now, the executive director or the president is not American, so we can have leadership that transcends the national borders, which means that you can be leaders not only in Egypt, but in other parts of the country. We have to educate our nurses to have service commitment. It is important that nurses attend meetings, attend councils, and support their leaders, and that they are professionally engaged. Some of the ways, just like I said, that we can overcome challenges, we have now virtual libraries and simulation centers that can provide a lot of education for nurses who do not have to be at the University of Massachusetts, Boston, because it costs millions of dollars to have the simulators. Use of technology, cost sharing, and partnering with faculty in global health research, practice, and education. Examples will be having the professors from University of Boston, Massachusetts, Boston, to come here, and some from the Cairo University to come to University of Massachusetts, Boston. Last slide I have is how we can improve the role of nursing in low-resource countries is through research collaboration, policy and politics, use of technology, leadership development, and educational partnerships. And that ends my speech, and now I have to invite Ms. Kathleen Houlihan to do the other. Oh, well, okay, thank you. I am asked to open the discussion, so you want to?
Okay, thank you very much, Dr. Anahid, okay. And we would like to open the time for some discussion or questions if anybody would like to raise any query. Is there any questions? Okay, Dr. Nafisa is going to ask, and then there's Dr. Ghada, okay? Do you have a mic?
Oh, well, if you don't have, yes. Oh, that's all right, it's only one question. The relationship, if you don't have enough nurses to do the care, you don't have enough nurses to go and get their master's and PhD so that they can be involved in the research. A lot of floor nurses are involved in data collection. And if they are overworked and underpaid, they're not going to be either see the role model or be consumers of research or participants in the research. So, and again, of course, if you don't have the image of nursing is not good, to get a PhD in nursing may not be as desirable as it will be if it was better paid and better, it had a better image. Did I answer that question? Thank you. Any other question?
No, just a comment. Do you mean data collection as nursing is working as a team of research? It's not a not a PI or a research?
No, because a lot of times we have data collectors that are on the floor that collect data. Of course, they have to be trained as on part of the research team. They can't be PIs, but if they see PIs working with them, there will be more incentive to become nurse researchers. And frankly, I would have not gotten my PhD if I was not exposed to researchers. So, any other question? There is more.
Dr. Anahid, thank you for the very good presentation. I had the experience of working with some funding organization, and during all the meetings, many people suggest that we should strengthen the collaboration with the universities from the United States and from the UK. And I have a question. If we make these collaborations with universities from outside Egypt, why our students doesn't take the license to work in these different countries, you know?
Why our nurses cannot work in different countries?
Why our students can't work? Sometimes we make collaborations with the universities, you know?
Right, because the United States has its basic standards, entry to practice, you have to be licensed. So you cannot work without having a license. So that's why I was saying if we can globalize education, and we have some of standardized, and a lot of places are doing, the American University of Beirut is trying to, so that they can take the NCLEX exam, and NCLEX is becoming actually more open because now you can take it in Philippines or in England or in India so that you can practice. But the laws in United States, and it's true standardization of care, is that you must have at least the registered nurse licensure before you practice. And I do always encourage all our PhD students that come from other countries that they take their licensing exam. And when I had 3 of my PhD students who did not care to take the exam because at that time they were doing their PhD, I practically had to force them to take it, because when you are young, not like us when we're old, we've left the profession for a long time, the clinical, so I probably wouldn't pass the nursing licensure exam. But the people who are the students who are young and just finished their bachelor's, they can pass the NCLEX exam a lot better, and 3 of my students did within the first try. So it is open. You can take actually the licensure if you want to. Right now, I know it costs money, but you can call the CGFNS, it's on the website. All you have to do is prove that the university has an accredited or close to accredited standards of education. You can take the exam, it will cost you probably $1,000, but I tell my students, without being licensed, you won't be able to be paid the $45 an hour that you're expecting to be paid once you graduate. So it is important that you get licensed. And that's not only for United States. When I was in Jordan, they would not allow you to actually practice nursing without having the Jordanian license. So it's across others.
Okay, thank you. We will postpone our discussion until the end of the session for the time being. Yeah, after that. And thank you, Dr. Anahid, for your fruitful information you give it to us. We are in the same boat. We have the same challenges. Okay, thank you, Doctor.
Now we invite Dr. Kaslan.
No, this is it. This is it. Yeah.
Dr. Kaslan Halwan, is that correct?
It's the same one.
Holohan, yes. Director Nursing, Patient Care Service, Pediatric Oncology, Inpatient and Outpatient, and Nurse Consultant Global Health, Dana-Farber Boston Children Cancer and Blood Disorder Center. Please, you are invited.
No, that's not me. That's not me. That's not me. I was already up there before. Just go back to the other one. No. He put the wrong one up. What? That's not me. That's you and he. Tell him to put the one that was up before. Same as Anahid. This one, this one, this one. Yeah, that's okay. Oh, yeah. Let's see. Thank you. Oh, thank you. Good morning, everyone. Sorry. I would like to say thank you to Cairo University and Children's Hospital, Cancer Hospital of Egypt for the invitation to come and speak here. It is my pleasure, and I'm so happy to be back. Just a little bit about my experience in Egypt. In 2009, I was invited to come to this hospital to give a presentation about nursing and do a few classes on training and education. And ever since 2009, I have been coming at least 2 times a year back to this hospital. So I have many friends here now in nursing and physicians. And it's just such an honor and a privilege to be back here, but also to be speaking. We also have colleagues from this hospital that come to Boston Children's Hospital and the Dana-Farber Cancer Institute where I work. Also, it's Nurses Week in the United States right now. So for one whole week, we are celebrating nurses. So on behalf of the nurses from America, I would like to say to my colleague nurses in Egypt, Happy Nurses Week. One of the things that I think is very important for people to know that is in the United States, a survey was done by to the people of the United States to ask about what is the most respected and trusted profession in our country. Is it doctors? Is it lawyers? Is it electricians? Is it nurses? Is it teachers? And again, nursing came out first and is in the United States the most trusted profession in the United States. Everybody loves nurses in the United States. And I know here the patients love them too when you get to know them. I've had a great experience here seeing how nursing has elevated the practice just at this hospital by all of the things that I will discuss in my presentation today. Just a little bit about Egypt, the World Health Organization. The population's around 80 million, as you probably know. Number of nurses trained, and this is 2011 statistics, is about 300,000 nurses. Nursing is one of the most skilled professions, and there seems to have been little change over 30 years, except in this building right here. I can speak from my hospital every year becomes the #1 children's hospital in the country, or #2 when they have ratings. And I've observed many, many days here of nursing practice. And the practice here is elevated close to what the practice is in the United States. So all Egyptians should be very proud of nursing here. Organizations partnering with nursing around the world, this isn't just here, is the World Health Organization. Right here in Egypt, your Ministry of Health, as you just heard earlier, are partners with nursing and committed to elevating the practice. Higher education academic centers, as we have our colleagues here from Cairo University and the University of Massachusetts, are very committed to training and educating nursing so that the patient gets the best care possible. Other clinical centers of excellence are where I work at Boston Children's Dana-Farber, but also here, Children's Cancer Hospital of Egypt. Education, training, and outcome. Is that me? Is that me? Is it? Hello? Oh. Okay. The most important thing, or the most important aspect of providing the best possible care for the patient, is that the nurse has great education, training, and outcomes. No matter how smart or intelligent a nurse is, if they don't have the proper training from the university level when they go to get their degree to the clinical level when they are working in hospitals, they are not able to provide the best possible care to the patient. Patient outcomes depend on a well-educated nurse force. I know here at this hospital, the training is more than 1 day. I've been to many hospitals around the world, and sometimes the nurse has no training, or 1 day or 2 day training only. I know that here we have a very comprehensive, competency-based curriculum that nurses follow with preceptors. Research has shown that lower mortality rates fewer medication errors, and positive outcomes are all linked to prepared nurses with baccalaureate and graduate level nurses that get their degrees and then the formal orientation. So one of the things that we're speaking about and Dr. Anahid spoke about is the image of nursing. So I went through and did a few topics. So to support and elevate the image of nursing throughout the world, nurses need to be skilled and knowledgeable, and this happens through ongoing evidence-based training. Once you're at the hospital, an organization that has training and education needs to be evidence-based. When I started as a nurse, I have been a pediatric oncology nurse for 30 years. We just did things because we thought it was the right way, or the other nurse told us, do it this way, don't do it that way. But there was no evidence base or science behind why we did things. Today it's important that we have evidence-based training for nurses. We must provide them with teaching materials and guidelines. We need to support nurses going to conferences. I know Miss Nazarene has been to a conference in Europe and presented her work there as well. And that is a big accomplishment for this hospital or any hospital in the world. And the hospital here should be very proud that they had one of their nurses in another country presenting the work done here. We need to recognize accomplishments of nurses. We have, in the United States, we have the Nurse of the Month. We have a Daisy Award where a nurse is nominated by a patient or family. And then we also celebrate Nurses Week. Back in Boston, they are having something every day, whether it's speakers, whether it's research nursing speaking, whether it's a party. We have a big dinner one of the nights just to celebrate all of us and the great work that we do caring for patients. Certification is very important in the United States now. Where I work, we are targeting that 100% of pediatric oncology nurses are certified. Right now, we are at about 80% of my 300 pediatric oncology nurses are certified in pediatric oncology nursing. To improve the image of nurses, we have professional organizations. We have nurses that join the Association of Pediatric Oncology. We have ONS, or Oncology Nursing Society, for patients, nurses that care for adult patients. We have surgical nursing in different organizations. We have publications and presentations. Many of our nurses present around the country and often around the world about work that they've been doing. It can be anything about caring for central lines. Often it's due to some of the research or evidence-based practice programs or projects that they're doing as well. We showcase the media. I know that this hospital is so great and committed to nursing, and I have even seen the commercials about nursing in other countries in the Mideast when I've traveled around, about how important nursing is based on the media coverage here. And I know there's a lot of media. When we come, when I come to visit with my partner, doctor colleagues from Boston, Dr. Alvonega, the first thing he does is say, "You're going to be on TV tonight." And so he puts us on, but he doesn't just put the doctors on the TV. He has me go on TV too to represent nursing. So I can see here that nursing is very valued here by physicians and other nurses and the leadership here, and all the way to the Board of Trustees, which is very important. We also want to respect and have a respectful relationship with the multidisciplinary team. In the United States now, it's a multidisciplinary team that cares for the patient. It's not just the doctor here and the nurse here and the pharmacy here. It's the group together, the team cares for the patient. I know that's also the model here. I know Dr. Sharif Kamal and works with the physicians and the nurses as well, and the model here is that we need the team to care for the patient in order to be successful. We need to synchronize so that we are able to increase the image of nursing. So education, research, Dr. Anahid talked about increased clinical practice and professional activities in all areas. And here's just a little bit that you probably know more about than I do, but I said, I cannot do this presentation up here unless I speak to this hospital that has already done many things and strategically increased the image of nursing, not just in this hospital, but throughout all of Egypt. Here we have competency-based training and education for new nurses that start. Preceptors, we have specialized nursing roles. I know some of the specialists are sitting here right now in the audience. We have nurse leaders, we have nurse educators here at this hospital, research nurses, infection control nurses, and trained pediatric oncology nurses. We provide opportunities of growth through this hospital for going to conferences and ongoing training and education. Ms. Nema talked about the accreditation or the